Good afternoon and welcome to the Midday News. Here's what we have in the bulletin. Transport operator groups to make proposal on the payment of outstanding traffic tickets for cabinet review. Stakeholders in St. Catherine apprehensive about new SOE. And later in sports, Windies prepare for test series against Australia with first warm-up game starting today. Thanks for joining us. I'm Shane Masters and here are the details. 4 transport operator groups are to put together a list of proposals on the payment of outstanding traffic tickets to be submitted to Cabinet for review and discussion on Monday. This was agreed yesterday during a meeting with Transport Minister Audley Shaw. Normality returned to the public transportation system yesterday following Monday's protest by bus and taxi operators who stayed off the job to reinforce their call for a traffic ticket amnesty. Head of the Transport Operators Development Sustainable Services, TODS, Egerton Newman, says the 4 groups representing transport operators will be meeting today to decide on the proposals to be presented to Cabinet. A call this afternoon for increased police presence on the streets to help curb the level of indiscipline on the nation's road. It comes from retired Senior Superintendent of Police Radcliffe Lewis on the heels of a widespread disruption in the transportation sector on Monday.
More than 400 people have been killed in road crashes since January this year. According to the Road Safety Unit, the main cause of fatalities was excessive speed with no regards to condition. Retired Senior Superintendent of Police Radcliffe Lewis says the rampant indiscipline on the nation's roads is due to limited police presence. He believes the traffic officers are being assigned to tasks other than traffic duties.
The police corporal who is a traffic man and maybe the constable. The police corporal is used to do station officer duty from 6 p.m. to 6 a.m. It simply means he is not present during the day until 6 p.m. And when he is off 6 a.m., there's another day that is lost.
This, he reasons, results in the limited hours the police spends on the streets. He adds that motorists will most likely adhere to the road code when traffic officers are present. Therefore, their absence contributes to the mayhem on the streets.
If the operations department, which is headed by a portfolio officer, is not paying particular attention to that area, then the commissioner of police will have to deal with it. Because the crime and the fatal accident are neck and neck. They are neck and neck going to the winning post. That is the problem.
Meanwhile, Mr. Lewis is also suggesting that the white lines in the roads be replaced with yellow lines.
Because yellow is more respected. And there must be a system where you educate the motorists to tell them that, listen, this is a new system. And once you overtake over the white line, no mercy will be given. Once you're caught, your vehicle is going to be seized, wrecked, and taken to the station, and you will be forthwith arrested. That is something that you have to put in place to deal with the traffic accident.
Sandy Williams, TVJ News.
In other stories, it's been 2 months since the Health Minister's Code Care program was launched in Western Jamaica. Now it's expected to significantly reduce the backlog of over 7,000 patients waiting for elective surgeries. The Health Minister gave an update in Parliament on Tuesday. Prince Moore reports.
After being launched in September, the Code Care program was expanded to eastern parishes in October. The Health Ministry expects the program to significantly reduce the waiting list for hernia, hysterectomy, and prostate cancer patient surgeries over the next 10 months. According to the Health Minister, the program has been going well.
Madam Speaker, over 170 patients have been to date removed from the waiting list for elective surgeries, many of whom have been waiting for over 4 years. We started with the longest wait. This number also includes approximately 35 children who receive surgeries for ear, nose, and throat procedures at the Bustamante Hospital for Children.
8 private medical facilities, 3 in St. James and 5 in the corporate area, have signed on to carry out over 500 surgeries within the next 10 months. In addition to the surgeries, the program also promises upgrades for operating theatres. Dr. Tufton says so far, $950 million have been allocated to the project, with most of it being for upgrades to 9 operating theatres in 4 hospitals.
To date, the teams have begun the process of developing the estimates for the renovation of the facilities, and the ministry will utilize emergency procedures where possible to effect the works that are urgently required on these facilities.
2 other agreements have also been signed with health training facilities in the U.S. This promises joint training for Jamaican healthcare students, making them qualified for work in both countries.
So in one case it will be between the government and the University of Miami Health System. In another case, it will be between government and Hartford Health System. What does this joint training mean? An agreed course outline, sharing of faculty, the possibility of sharing of clinical rotation. So some of those, there may be a case for the nurses to go to those systems and work in those hospitals to rotate around the practical component of the training, and the use of technology through simulation.
It's hoped that this training will benefit both countries, as Jamaican nurses will be able to work overseas while residing in Jamaica. Prince Moore, TVJ News.
Meanwhile, plans are underway to upgrade the Otrius Health Centre in St. Ann at a cost of $200 million. Codian Barrett tells us more.
While addressing health practitioners and other stakeholders at the St. Ann Health Facility last week, Health Minister Dr. Christopher Tufton said that population growth and the unexpected challenges that come with being a healthcare provider in a resort town make it necessary for the expansion. Among the plans,
Better parking and more parking, better waiting and more waiting spaces, all the services that are currently being offered, which are maternal and health services, pre- and postnatal care, immunization, family planning, oral health, curative nutrition, mental health, lab, pharmacy, disease surveillance, environmental health. Now, if you tour the facility, you realize that is a cram set of space there to do all those services. We're going to add bigger spaces for those services and add additional services.
he added that employees will at long last be given the tools and breathing space to do their jobs in a more effective way, because for a period of time public health has not been given adequate resources while the demand on the system continues to grow.
Oftentimes, we are given a basket to carry water, in that we are expected to respond to an emerging, increasing set of challenges without the commensurate support over the years in resources, in infrastructure, in equipment, and sometimes even in personnel.
But how soon will the upgrading be complete?
Soon. If you say, for those who want to say how soon, I'll say soon, soon. Well, let me give you the specific. We have the plan, the designs, the architectural work. This is an artistic impression, but we have the actual designs. They are being finalized. Once that is finished, it is about going to market for procurement and of the contractor. And once that is secured, then we can start to break ground. So we're looking at sometime in next year.
Codian Barrett, TVJ News.
The Ministry of Education, along with the Jamaica Constabulary Force, launched the Anti-Gang Week in school on Sunday. Now, this initiative, under the theme Leg of the Gang, Lift Up Jamaica, follows the recent flare-up of violent incidents in schools across the island. More in this report again from Codian Barrett.
Speaking at the launch of the Anti-Gang Initiative on Sunday, Education Minister Favour Williams pointed out that while Jamaica is fortunate to not see any incidents of firearms in schools, the threat of possible usage is a serious problem.
Data from the Jamaica Constabulary Force on children arrested for gun-related crimes between 2018 and 2020 in ages ranging from 12 to 18 show a total of 18 for murders, 24 for shooting in 2018. In 2019, it was 13 for murders, 26 for shooting, And in 2020, it was 23 for murder and 32 for shooting.
Mrs. Williams says this data should cause an increased concern for every Jamaican citizen.
We're also aware that the psychosocial impact of community violence often sometimes spill over into gang conflicts played out on school premises. We know as well that within the schools, no learning is going to take place when students feel uncomfortable, when they're dealing with trauma from circumstances that occur outside of school grounds, or are anxious about their safety.
Meanwhile, head of the Counterterrorism and Organized Crime CTOC ACP Anthony McLaughlin says he supports the message replayed by Education Minister Favour Williams. He says Jamaica's biggest problem is recently the increase of gangs in the island.
We look at the crime statistics. We are over 1,200 murders since the start of this year. And ladies and gentlemen, of that number, over 80% is directly caused by gangs and gang activities.
ACP McLaughlin says it is not only for the Education Minister and JCF to join this fight to protect children, but this requires a joint approach of every citizen to rid Jamaica of gang-related activities. Cody Ann Barrett, TVJ News.
And it's time for a break here on the Midday News, but please stay with us. More stories when we return. Welcome back to the Midday News. Stakeholders in St. Catherine say they were surprised with the announcement of a state of emergency for the parish. They say based on information from the police in the parish, crime has been on a downward trajectory. Hence, the announcement by the Prime Minister on Tuesday was a bit shocking. President of the St. Catherine Chamber of Commerce and Industry, Dennis Robotham, says business owners are apprehensive about the effect the state of emergency will have on sales during the Christmas season and so are tentatively in support. He says pronouncements by the police leadership in the parish suggested that the statistics for serious and violent crimes had declined. Speaking with TVJ News, Mr. Robotham says businesses are preparing for a robust Christmas following 2 negative seasons and will now have to worry about the associated disruptions from a state of emergency.
The business community is kind of wondering whether there's going to be implementation of curfews and hours, which is going to negatively impact the businesses. Those are the things that we need to know. We want to know too that the previous SOEs, if we have learned all that we need to learn, trampling on rights, we have paid out a lot of money in terms of trampling on rights, and we have lost. The taxpayers have got to pay that.
Mr. Robotham also noted that if the government had data on criminal elements, then a targeted approach would have been much better than the current blanket approach under the SOE.
If there's information that is privy to them and not to us, well, fine, we understand that. We just want to know and ensure that the thing is done in a timely and proper manner. We're not affected this Christmas by the SOE.
As for Chairman of the Municipal Corporation in the parish, Norman Scott.
As a member of the People's National Party, I'm hoping that the opposition will only allow for the 14 days to elapse on this one.
In the meantime, Mr. Scott says he's awaiting the regulations which will govern the SOE. That includes the time that business places will be required to close and possible weekend operation times. And for the details on the development of the economy, here's Cody Ann Barrett with the Business Minute.
In the world of business, JMMB Group Limited will avoid paying dividends for now as profits and capital decline. The company last paid interim dividend of 25 cents per share in July, which amounted to a payout of nearly $490 million. Preceding that payout, its declared distributions to shareholders for the full financial year ending March topped $1.66 billion. In the UK, food prices are rising at their fastest rate in 45 years. Latest figures show food price inflation hit 16.2% in the year to October, up from 14.5% in September. Energy and fuel costs also rose sharply, pushing the overall inflation rate to its highest level since 1981. The overall inflation rate jumped to 11.1% in October, which was the highest rate in 41 years, and up from 10.1% in September. That's it for the Business Minute. I'm Cody-Ann Barrett.
And here's a preview of what's coming up in this evening's health report.
In this evening's health report, we look at diabetes diet.
It can cost more to eat healthy. But if you're choosing things like peas and beans as your source of protein, you can still get that cheaply. You can still get vegetables cheaply, like your callaloo. Go local when it comes to your fruits and your vegetables, buy in season. If you're choosing a lot of imported foods, which are very costly, then that may be an issue. So if they understand that they can still eat a healthy, balanced diet with foods grown locally, I'm so happy to see now that a lot of the things that used to be imported are now being grown locally.
That's a health report in Primetime News at 7. And now for today's healthy living tip. Eat less salt. Eat less red and processed meat. Eat more fruits and vegetables. And be smart with snacks.
In news overseas, former President Donald Trump is once again running for president in the United States. He made the official announcement Tuesday night as he addressed supporters at his Mar-a-Lago estate in Palm Beach, Florida. Now, Trump is expected to face a crowded Republican field that could include Florida's governor and his former running mate, former Vice President Mike Pence. And we head to a quick break. When we come back, Renardo Brown will have your midday sports report.